Hi, I am Dr. O.S. Siva Prasad, consultant pediatrician and neonatologist working at Cloudnine, Thanisandra, Bangalore. The premature babies, especially who are born less than 34 weeks of gestational age, will require a neonatal ICU care. So, any premature baby who was born less than 34 weeks, their maturity will not be as on par with a term baby. Means their physical growth or the organic growth, like in the form of lungs, brain, or the other organs in the body, they'll be little premature compared to a term baby. So that is why they need NICU support and the support which we need to given to the baby to help the baby grow better, and mainly the feeding coordination which happens between sucking, swallowing and breathing. That coordination naturally occurs around 34 to 35 weeks of gestation. So before this, most of the babies might require little feeding support, so until the baby attains that maturity, and we always help the babies in the NICU right from temperature maintenance. Most of the premature babies cannot maintain temperature on their own in the initial days. That's why we keep them under the warmer care. And then nutrition. So because the babies doesn't have a proper sucking coordination movement or swallowing movement, we give initially through the orogastric tube feeds, which is the tube through the mouth. Initially, once they attain the maturity, like once we feel the baby is better around 32 33, then we start giving them challenge of direct feeds and all. So then along with the nutrition, the third thing is because of the immature lungs, so they might be prone for initially little oxygen requirement. Especially in extreme premature babies, there is a condition called as bronchopulmonary dysplasia, which they can be prone for in the future. So as the baby grows, so along with the baby's physical growth, the lung also should be growing along with that physical growth. Sometimes when the baby is born extremely premature, especially before 26 weeks of gestation, this lung development might not be on par with the physical development, and they might require prolonged days of oxygen, and there are certain conditions where we might opt for sending the babies with home oxygen also when the parents and baby are okay to go home. One is the lung development. Along with that, we always keep checking for the baby's brain development, especially clinical examination we keep doing regularly on a regular basis. Along with that, we keep regularly seeing for any bleeds in the ventricles in the brain. So that which premature babies are prone to. Any bleed in the baby's brain, ventricles, so are any other symptoms which we see little abnormal in neurological examination, we always keep a close watch and follow up. These are premature babies can be prone for intraventricular hemorrhage. Other thing which the premature baby might be prone is infections. Premature babies have a very low immunity compared to a normal baby. That's why infections are always a part of this baby's course of hospital. So we always take utmost care to prevent the infections in the baby. So these premature babies, whenever they get any infection, has to be treated with appropriate antibiotics and has to be supported well. And the other thing which any premature baby has to be closely monitored is for the development of eye, what we call as a retinopathy of prematurity. So there is a condition, can be the blood vessels in the retina might not be developing as in the right direction. That is when they might get this condition called as retinopathy of prematurity. That's why we have international protocols to monitor the baby's retinal development as the baby grows on a particular basis, and we have to keep it closely monitored for the retinopathy of prematurity and has to be treated if required. So these are the one of the most common conditions during the course in NICU. But if in extreme preterm babies, when they are not growing, they are not gaining weight appropriately, or they are getting growth restricted, they can be prone for metabolic syndrome in the future. So like for example, obesity or diabetes or hypertension, these are the chronic diseases. So where they can be prone in the future when they are having most of the growth restriction or extrauterine growth restriction in NICU, what we call, when they don't cope up with the normal growth as expected. So these are certain conditions in the premature babies where we can expect little things which can go little deviated from the normal development. So and once the babies are getting discharged from the NICU to home, so there are certain things which the parents has to look after. First and foremost is the temperature. You have to maintain the baby's temperature and make sure the baby is warm. So otherwise the baby's development and growth might not be correct, and babies can have detrimental effects of that. And second thing is proper feeding. So before getting discharged from the NICU, always make sure you are confident of feeding the baby, taking care of the baby's feeding needs and positioning, holding the baby's position, post feed, how to burp the baby and how to take care of the baby's feeding needs. and any other medications which are needed. So that is, and second thing, that nutrition is utmost important for the baby's growth after going home. The third thing, prevention of infections. Make sure any, like at household, you always have to take care of the safety and security of the baby with preventing infections, or just avoiding contact with the people who has a bad respiratory infection with the babies. Along with that, vaccinations, time to time vaccinations as suggested by your pediatrician. So always has to be given to the preterm babies, because they help the babies in preventing deadly infections and help in the immunity also. So along with that, overall developmental thing also is needed for the premature babies. You have to give skin to skin care to the babies. You have to speak with the babies. You have to be in a good mood with the babies. You have to sing lullabies. So all these things will help a good environmental factors which helps in the better neurodevelopmental outcomes in premature baby.